Hey, welcome back to another episode of Muscles and Malpractice, your weekly dose of fitness, health, and everything in between. I'm one of your hosts, Andrew Bustos.
And I'm your other co-host, Dr. Stuart Martin, in the house.
Ooh!
Yeah.
And
Don't I sound so much better, bro?
you sound great.
Right? Man, I sound like I was on death's bed last time when you heard me.
Dude, your attitude was poor. You were, you were so mad at life. No, I knew you didn't feel well. I knew you
I
didn't
was
feel well.
like, look,
You were
Katie,
sick.
yeah, I was sick. I think Katie finally admits it a little bit. You know, she's in Abilene today. Like, she even like, so she's in Abilene, and that's why she can't be with us tonight on the podcast. Unfortunately, guys, it's like the one Monday ever. Like she unfortunately is unavailable, and so she's in Abilene at Hardin Simmons doing her job duties. It's the nursing school pinning ceremony tonight. So again, as the simulation and clinical coordinator, she has to be there for those young ladies. So she's there. I have it's all hands on deck. I have my actual nurse that came with me from Abilene taking care of Sam in another room right now after I picked him up from daycare. And we're getting this done because this is something we really care about. Even Katie cares about it. Of course she cares about it. But anyways, that's why she's not available at the current episode. But yeah, like I just wasn't feeling well. So I'm glad you and Katie, man, I'm excited for what Katie and you are going to bring in terms of content going forward. 'Cause I just think she's good about doing exactly what she was kind of saying, like bringing insight into the show that even being an OBGYN, I feel like the majority of our audience is female and they want a female voice. It's kind of weird to like, you know what I mean? Like, it's not weird, but like at the end of the day, they're listening to two men and one of them is predominantly going to be associated with the female perspective, but we never brought the female perspective into the show. So it's just so great to kind of hear her asking questions at times. And like, I just think that's going to be so awesome for us going forward. But she is unfortunately unavailable tonight. But yeah, she finally admitted to me she was a little dismissive of my symptoms because again today she even called me while I was at work and she was busy with her job duties too. And her coworker goes, "Yeah, we had to get her a Sonic drink so that she would stop being so moody towards us." And I'm
Whoa.
just like, well, that's pregnancy though too, man. Like I just you grow a thicker skin when you're the partner in a pregnancy. You know what I mean? Like you better.
Yeah, your skin was pretty thin
It's
about 2
thin.
weeks ago, but it's
It's
gotten thicker.
yeah,
You're
I
a little
agree. I
thicker.
thicked
You
it up a
have.
little. I thicked it up.
Yeah, you have. You probably would have started crying some of the things we were
I
telling you
might
2 weeks
have. Y'all were
ago.
kind of
Yeah.
being mean to me,
We were
man.
coming
Like I
after you.
found picking on me,
Yeah.
you
But,
know?
I guess most women just listen to us, and what most women do is they complain about listening to 2 men, so I'm glad we brought a woman in. I'm glad we did.
Now you can't complain about
They
it,
complain
ladies.
about us
So yeah.
anymore. You can't find anything wrong with us because
Yeah.
we have a woman's perspective.
Well, and I even so I have all these people in my the clinic I work for now. Oh, love my clinic. So many great people at it. But it's huge. It's like, again, I'm the 5th OBGYN to join it. I'm the 7th provider because there's 2 nurse practitioners too. And it has ultrasonographers, it has all these different types of people under their employ.
Umbrella. Ella.
Right. And so I constantly get approached by the billers or today was one of the ultrasоnographers so what really is your podcast about? And I was like, it's really hard to describe. I'm like, supposedly it's, healthcare, fitness, and everything in between. And I would say a lot of episodes fall under the majority everything in between. But the formats are very different based off whether it's you and me versus when we include Katie now, which is a testament to Katie. I think she's really redefining, kind of what our target topic focus would be. I think Katie just brings a different dynamic to it. She kind of is able to be like, she gives us topics almost
Yeah.
like to kind of go off
Mhm.
of a little bit.
Here, I'll do the Katie real quick. "Hey, y'all don't know what you talking about. Hey, y'all, you don't know
I
nothing,
don't know
Andrew.
if that's the best.
You don't know me."
You
I don't
don't
know, dude.
know me,
"You don't
bro.
know how it is."
Katie, I will tell you too. What's crazy is Katie gets me more like referral. Like there are just so many women that are like posting on like the post on the Alito female like
Mm.
women's page or
Oh,
like the
that's cool.
community page or whatever. And like Katie will be on there and she'll be like, I just really like
Oh, yeah, so you're
there's people
yeah.
from all over West Texas who either grew up with Katie or know Katie and her family or like
Mm.
post on pages where Katie's socially connected. And Katie's like, look, I know I'm impartial or I am partial because he's my husband, but I just think he's like the greatest OB ever. And then they come and see me and they're, you know, again, my job is to deliver on that promise. And
No
I
pun
feel like I
intended.
do.
No pun intended.
um, but I just think that's like that is so wonderful, and I've told a lot of patients out lately. I'm like, I don't think I'd have half the patient referrals and like business if I didn't have my wife being one of my biggest fans and advocates, which I just love. Like, I just think that
Mhm.
speaks so much to like what a wonderful lady she is, what a great thing she is for the world in general. So I love you,
Aw,
Katie. I miss
Katie,
you
he loves
tonight.
you.
Me and
Miss you,
Sammy miss
Katie.
you.
I miss you
Um,
too. Miss you too,
okay.
Katie.
Okay, we are 6 minutes in, and we are already not right into stuff. And I've got again, we have not been on air. Like I had one recording in the chamber, as I say to you and Katie sometimes when we got material ready. So I released that last week, but we have not recorded in 2 weeks. So there has been just so much
Mm.
that's gone on.
Mhm, mhm.
And I
What you
just
got?
think we start with the biggest thing where like my professional website even posted about it. And like, again, we all know where I'm about to go because my nurse constantly speaks to this too. It's just become a like, you know, tonight, bro,
I don't.
we're gonna have to do it.
Mm-mm.
We're gonna
Mm.
get a little into
Mm.
the political spectrum here. Here we go, dude. Because we have
Mm.
to, because politics has entered
Mm.
medicine, and that's not
Mm.
okay. That's not
Mm.
okay,
Or
Andrew.
is it
You
okay?
no, it's not.
Is it
It
okay?
will never be okay.
Freedom of politics and
Freedom of politics in medicine? What, like
medicine,
what
does
are
that
we
not
talking about?
exist? Or is it the free oh, that's freedom of religion or something.
I don't know what
I
freedom
don't
of
know.
any it
Some
is, though.
hmm.
So
Hmm.
we're gonna go ahead and share my first screen
What
here.
do we got here?
And we're going to start with the actual. I'm sorry. This is going to be a little TikTok driven because, again, I just, we're going to listen to the whole clip. Yes, there are sound effects to be for comedic effect, but
Yep.
then I have one or two other things to go through this
Uh-huh.
before I break down the science a little bit for people.
The
Okay, here we go. Here we go.
science.
Let's have some fun with this first.
Mhm.
A science-ish guy. It's great. It's science, important. Effective immediately. The FDA will be notifying physicians that the use of well, let's see how we say that. Acetaminophen. Acetaminophen. Is that okay? So taking Tylenol is not good. Don't take Tylenol. There's no
Don't
downside.
do it.
Bad can happen. It can only good happen.
It can
This
only
is
good
based on
happen.
what I feel.
This
It
is
a
based on what
rumor,
I
and I don't
feel.
know if it's so or not, that Cuba, they don't have Tylenol because they don't have the money for Tylenol, and they have
No, it just went away.
No, I think that's a good stopping
very
point.
careful with what he says, and he should, but I'm not so careful with what I say.
Dude.
Okay, hold on, hold on.
Aceta naga
Is that
not
not
gonna
gonna
work
work
in it
here anymore?
anymore.
Yeah, I know, bro. Okay, hold on. So here we go. Here's the way I hear some of the stuff he even says. Where did it go?
So
Okay, here we go.
okay, go
Here
ahead.
we
Nothing
go.
bad can happen. It can only good happen.
So me think, why waste time? Say lot word when few word do trick.
Hey, dude, it's the
Nothing
truth,
bad
dude.
can happen. It
You
can
know what?
only good happen.
I
me
understand what he's saying. I get what he's saying, you know?
No, no.
But
Okay,
here's what I
look.
wanna know,
No,
though.
no,
Okay, but
you can't.
explain
No,
to us,
you
Doctor
can't, bro.
Martin,
No,
before
you
you
can't.
go on. Explain to
Okay,
us.
okay.
So, Acetaminophen is found in Tylenol
Mm-hmm.
and generic Tylenol.
Acetaminophen, Tylenol is name brand acetaminophen.
Right, okay.
There's also paracetamol, or it's basically a very similar version to Tylenol in Europe.
Uh-huh.
We don't use that one here, but yeah.
So what's the deal? So what's the big thing about all this? I understand maybe most of our listeners don't know what's going on,
Um,
so explain what's the big idea here? Tell us.
so look, I'm gonna tell you what they believe they're basing it off of, but like I think we should have a real problem with the idea, even in general, that like again, my nurse is fielding daily questions from patients now
Mhm.
on a concern about taking Tylenol. And this comes from,
While you're pregnant or while you're just
yes, just
alive
no, but
or
while you're
in
pregnant. But
general?
dude,
Oh,
this is
okay.
a category A medication we have used for decades.
What's
It like
category A mean? Is that
Category
like
A
a
means your prenatal
uh-huh.
vitamins are in category A.
Oh.
So, like, these are
Mm.
the only medicines that we have shown to be completely safe and without risk of hazard to the fetus in pregnancy.
Mm. Mhm,
And it
mhm.
is a very short list. Go look up the list of category A medications in pregnancy at some point and look at how many live there. Almost everything lives in category C, which says, okay, we think it's safe, but we don't have active human trials to say it is safe for sure, so we don't know.
Mm.
Category A is a very rare breed of medication. It includes things like Benadryl. I mean, it's
Ooh.
just it's not very many things. It's usually medicines that are old as dirt,
Oh.
like Tylenol, because we've seen them forever in pregnancy and they have been demonstrated to be safe.
Okay,
And
so what's happening?
this
What's the
type of
deal?
thing,
Well, no, what's going on? What happened?
I'm gonna tell you eventually. I'm gonna get to
Okay.
where they're
Just
drawing this from,
what are we doing?
but I
What's going
just
on?
think again, it's dangerous to even
Say
say it. Like, yes, because again, you're allowing people to distill information for you that have no qualifications to do that, and then they're getting out on the biggest platforms in America and scaring people about things that we've used forever and known to be safe, and not trusting the actual health experts to distill that information for them, correct?
so they're saying Tylenol is doing what to the fetus?
So they are deriving their recommendations based off of limited scientific studies that, I have to be clear again, I almost hate even talking about this because it is irresponsible to misrepresent. The only decent study is a Harvard study that looked at Tylenol use in pregnancy, and it had to do with the overuse, the
Mhm.
like a overdose or an overuse of Tylenol, which would cause an excessive buildup of the Tylenol product in a PQI, which is detrimental to fetal cognitive development. It's not good for humans without pregnancy to get a over dose of Tylenol and have an over buildup of NAPQI without glutathione to clear that buildup of that toxic substance.
Mhm. Mhm. Mhm.
So we're kind of talking about like, I was talking to my nurse today about it, and it's like, why aren't they out there advocating for no use of water in pregnancy? Because
Mm.
a pregnant woman can drink enough water to it's called water toxicity. So you can die and your fetus can die from too much water. So
So what
we're misrepresenting the Tylenol usage as Tylenol overdosage
uh-huh, uh-huh.
to
Mhm,
be
mhm.
unsafe and cause this outcome. And
Right.
again, this is one study that says an overuse or an overdose of Tylenol in this setting may cause an NAPQI buildup and may lead to these things happening. But you're not representing the facts clearly. You're not talking about safe, normal, recommended dosages of Tylenol that are used in pregnancy or by pregnant women and have been effectively and safely for decades.
Yeah. So what are you mad about? Like, what is everybody mad about? Are they mad because they got to answer questions now, or is
Mm,
what's the
Andrew,
hang
come
up?
on, man. Like,
Mm-mm.
so
So what's the hang
are
up
you
though?
being the devil's advocate? Because I know you're smarter than this. I know why you
No,
got to
no, no.
be.
Because you're gonna watch this. You're influenced
Mm-hmm.
by what you watch.
Mm-hmm.
You are in particular. Goodness gracious.
Okay.
But you're you're influenced by what you watch. So what was the demand on this? I can't remember. Was it like a couple weeks ago they got on stage and they were talking about nutrition? They were talking about like
So
what's the context of
here,
this? Because I get
here's
the
the
fact
con.
that
I mean,
that they
look.
shouldn't be saying these things, but I don't understand what the big hang up is if you know they come to see you and you go, hey, you're fine. Like why was there such an influence on this? Do you know what the influence was? Like what was the context behind this acetaminophen or whatever how you pronounce it is bad for the fetus? Like how did they come up with this? Who started this
Are you
conversation?
asking me to understand why the lunacy of some of these people in this administration is like, and I hate to use that word actually because that does start to sound politically charged. So let me back that
Mm-mm.
up a little bit.
No, no, no. I'm asking you
I will because
because you
what
because
you're asking me is to tie in why they think the way they do, and I
no, no.
frankly I think the medical field is confused at that.
Right, right. But what I'm saying is when he got up there to talk, he obviously didn't know what he was saying. So
Hmm.
what was the charge at him saying this? Were they talking about nutrition? Were they talking about the water? What were they talking about? He just got up on the mic
This
and
was a
said
press conference about Tylenol usage.
that was all it was. That
It
because
was
I
all
didn't see the
it
whole press
was.
conference.
Yeah.
So
It
I
no, he got up there and independently decided to second guess everything about established safe practices in pregnancy and prenatal care and what are known
okay, so without
because again,
yeah.
like I can't I have a clip of it, but it's the longer one, and I don't know that I can find it real quickly. But
So
Trump
regardless of
literally he starts to talk himself into a corner about like, okay, well, you know, if a pregnant woman needs something, they just gotta, they just gotta kind of toughen up and like, they just gotta do it. Like, and it's kind of like that. That's
that
what
sounds
you're
like me.
basically
That's like
like.
something I would say.
We as OBs, we already have a difficult time trying to give safe medical recommendations to pregnant women that they
Right.
have available to them.
Yeah, right, right. So
And
yeah.
it is a lot of times of this very careful, nuanced discussion we have to have, and also evaluation to make sure that whatever the pain is they're having isn't normal pregnancy pain, and they have to kind of like toughen their way through it and
Hmm.
like just bear their way through this, which he kind of says they have to do, versus like what are some standard treatments we have available. And he's taking away the only one we have that's like a medicine, like again, for any muscle aches, pains, headache,
Yeah, it's a great medicine.
fever.
Yeah.
And so that's the other huge, like if you want to just talk about medical risks that they just put out there
Hmm.
nonchalantly, is like they're basically advocating for women to tough it through fevers, which are much more detrimental to
To the baby.
especially
Yeah.
early congenital and fetal development. Yes, the maternal fevers and external heat exposure. So either a mom has a fever or they're in a hot tub or whatever in the first trimester. That is a much huger teratogen, meaning like
Yeah.
something that will cause fetal anomalies than Tylenol.
Right, right.
And now you're telling them not to take it.
Right. So what I was asking, because you just answered all that, I was asking like why did they were they talking to an OB-GYN that said, "Hey, don't do this," or
No,
he just came out and
no.
said
I
it?
mean,
He
ACOG,
just said
like
he just
you
said, "You
look at
know,
my
we're
professional page, man. ACOG literally later that day had to come out with a statement. I
oh,
posted the statement right
yeah.
away that was like, ACOG will continue to support and has supported the safe use of Tylenol in pregnancy and has like there are no changes to this recommendation. Like they had to right away. I mean, it like you again, it's scary because like the president and the secretary of health with no medical training or education or background
You leave him out of this."
are causing women, because this is a vulnerable population. That's the other
Well,
thing
especially during
that
that time too. Like, they're very
exactly.
vulnerable, and they're looking for
OBGYNs
answers.
know the type of patients we treat, and we know the way they are, and we know the way they think. And this is the kind of shit, and
Yeah,
I'm sorry to say it that way, but this is the kind of shit that we have to deal with the ramifications of when it's irresponsible. And
yeah.
again, like, we're the ones who have to foot the bill in terms of longer. And again, I don't dread the chance of education with patients, but like, this is undue harm. It's undue. Now, it's going to take years to stop this thought that now Tylenol is a problem for you to take. And I just, uh,
Well, that's pretty odd that he did that. There obviously is some other monetary value and
well, that's what
something
I'm saying. Like, I thought
somebody
you were
pissed him
asking me
off.
that, and I'm like,
No, no,
I'm
no. I
not
don't
doing the
know.
conspiracy theories on how money ties into this stuff, but
Money ties into
that's where it
everything.
is. It's
Yeah, money ties
everything,
into everything, and I'm sure Tylenol is owned by somebody he doesn't like, and I'm
right?
sure it's
No,
ran
I mean,
by some.
they did even
Yeah,
talk. I mean, people have speculated on how that was supposed to work and how you could play the stock market on the day that happened, and how you could play the Tylenol company, the
yeah.
owners of Tylenol, and how that just dropped like a rock after this press conference.
Yeah, well, it's gonna
Um,
to. I mean, that's dangerous. That's very dangerous, especially unless you have a physician backing this up and you have trials and trials. And but no, who's gonna do it? I mean, when it comes to another drug, but Tylenol isn't a bad drug. I've used Tylenol on me, my kids, my wife, my
right,
dog,
and
my
look,
everything. So it's not something that is gonna be harmful. And how many times have you used it on a patient? I
well,
think that's kind of you know.
and here's the thing. Look, I also tell people, like, I in the era before I had to defend baseless claims against it, um, I used to tell patients, I'm like, unfortunately, because some patients, unfortunately, even without count, like, even though we give them education materials, say these are the drugs you're not supposed to take, blah blah, they'll come into an appointment like, so I took like 2 Advil last night, and I'm like, oh my god.
You're like, bro,
And
I
I'm like,
told
"It's
you not to
okay,
do
it's
it.
okay."
I told you
Right,
not to
right.
do it.
I'm like, "Okay, that's not great." Like, and it's
You're
okay. Like,
dumb.
no,
I'll say it. You're
no.
dumb.
I'll be like, "Look, just please don't do that again.
Yeah, don't do
That's
that.
not a medicine you want to take. Please refer back to our safe medications list. Please take Tylenol first as your pain
Mm.
reliever, as your fever reducer." But I'm like, "Look, I know Tylenol sucks." Like, and it kind of does. It's the
It's not
worst
as
at
strong, right? It's not as
it
strong.
just, like, people don't tend to get the same relief. Like, it's a decent headache medicine. It's definitely a decent fever reducer.
Yeah.
It is not so great for muscle aches and pains like NSAIDs are. So, like, ibuprofen, like Advil, like
Yeah.
Motrin, like, naproxen, which is Aleve, like some of these other ones that do a lot better job of muscle aches and pains that pregnant women have a lot of, but you can't take for. So then you have to try Tylenol. I know it's not as great. And that's what I kind of say is like, look, I know it's probably not going to do the best, but like, I still tell patients in this day and age now of all this stuff that I'm like, look, you may or may not take Tylenol at home, but guess what's given to you the second you show up to labor and delivery with this complaint?
Tylenol.
Tylenol.
Yeah, dude.
And if you don't take it yourself, it's going to be the first thing we give you to see if it doesn't help.
Drip,
And
drip.
so,
Drip,
like,
drip.
why not try to expedite your own. That's why I tell patients, like, try to self triage a little bit. Like,
Oh.
and it's only going to help your triage, which is determining acuity of you.
Mm.
That's basically what triage means. If people don't understand that word, is that it's acuity determination, right? It's figuring out if your headache represents a tension headache, which is the most common type of headache, or it's a stroke, right? Like,
Dude,
so
what if I have pain up here? What does this mean? Like, it's like, right.
that's called a male pattern
Is that a
baldness, I
no,
think.
no, dude, I have all my hair. Don't even try that. It's like right there in the corner. See,
Bro, you're
I've
getting
been
more
trying
like the like old
something.
man haircut, man.
I need
What's
a
going
haircut,
on with
dude.
you? What's going
I need a
on, dude?
haircut.
I've got like the short hair now. And you've got like the little
Well,
J Beebs
hey, you
comb
go ahead and
over,
shave
dude.
that beard there. Yeah, we'll see what happens there, youngin. Yeah. No, I think that's good stuff because I also think the more that you can educate your patients through this and through your Facebook page and through everything is going to help. And then this is where my argument always comes to, like, get off your dang phone. Stop getting on Fox News. Stop getting on CNN. I hate it all. I don't like any of it, dude. You're too
Well,
influenced by it.
right.
Just too. There's so
So
much influence.
I
And
even brought this because I'm like, you know what?
oh no, my new book. Wrote this
I'm
new
gonna
book.
show people something that it's like I used to keep this in my clinic in Abilene. I don't anymore. I keep it at home, just as like kind of a way of counseling patients when I need to read because I keep it in my library.
What do you
But
got there?
uh, y-
You'll have to hold it up.
you want a book? Read the ACOG published Your
Oh yeah,
Pregnancy and
yeah.
Childbirth
Read it
month
last
to
week.
month.
Yeah,
It is this thick. Okay. People want to go on the internet and read for hours and
just read that bad
hours.
boy,
This thing will tell you everything from how the blastocyst forms to like
dude.
before and at preconception to postconception. It's got pictures of every month and week of your pregnancy.
No way.
So, like, I'm sure there's a new edition, but if you want references and you
Mm.
want good investigative evidence-based medicine, stop Googling and get stuff from like
What's that one?
ACOG.
Your
Look, hold
pregnancy
on.
and
Oh,
childbirth.
it's gonna mess me up because it's my
Yeah, don't
face
do
that
that, dude.
follows. Hold on, hold
So
on.
your
Oh,
pregnancy.
see, it keeps messing up because it follows the face. Hold on,
So I
follow the
can read
face
this
down.
off for
Follow the
people. Can you
face
get this
down.
on
There we go.
Amazon? Your pregnancy
I
and
bet you
childbirth,
can. I
month
don't
to
know.
month.
I don't know if you can't get a. But look, follow the American College of Obstetricians and Gynecologists. That's who published this book. That's
They
who
sound pretty
I.
smart to me. They sound like a bunch of
It sounds
yous
like
there.
they might know what they're doing.
Not the president
They
or the
might
vice
not the
president, who are men.
Oh, and then
Hello.
just let me get started on this guy, dude. So
Oh, what you
again,
got over there?
I got another
What
guy
you
that
got
I
over
need
there?
you to see, and this is okay. So this guy came up in the Tylenol, like the whole debunk, and
Ooh.
he got kind of
Mm.
destroyed a little bit.
Oh, there
But
was a
like,
doctor or chiropractor?
he is a chiropractor.
Why would
But
you do
can you
this?
tell that he is a chiropractor? He
No,
got
you
blamed
can't.
so hard because how many chiropractors need to wear a surgical cap?
Hey, dude, they got surgery, bro.
So this guy did his
Dude, that's
absolute best
bad.
to misrepresent himself.
That's
And
bad.
it is impossible to figure out. It is almost impossible if you go on his stuff to figure out what degree he has. I thought he was a
Whoa.
naturopath. Like I thought it was all this different stuff. He got stitched like so many times that he blocked stitching because every doctor was flaming his thread endlessly.
Let's hear it. I want to hear
That
this.
acetaminophen and Tylenol are bad, but we really don't know why. So let me break it down why it's bad. And we've known this for a really long time. It's just our public health policy in the United States is absolute garbage. So here we go. When Tylenol is detoxified, it produces a toxic byproduct called NAPQI. This causes a lot of problems for the liver. It causes brain inflammation. It causes problems systemically. This is not just a kid problem. This is also an adult problem. As we age, glutathione storages become depleted.
So he's eventually going to plug his own fucking product. I'm sorry.
I agree with
just
him.
have to.
I
No,
have to
and
agree.
so look, I'm not even getting into all the doctor threads I have that stitch him and just destroy him. But like, look,
Dude.
it what's sad is the
Just for the
guy is
likes,
kind of
dude.
smart. Like and that to me is the worst part about this is I know he's smart enough to know he knows what he's doing. And that's
Well, he's a
what
good
I find
marketer.
so
He's a good
problematic.
marketer.
He's good at being predatory and
Yeah.
deceptive.
Well, okay, but
So look,
Yeah.
here's I want to highlight
here's my
another
issue.
big
Here's my issue with you and your other physician friends. You guys don't get on here and say anything. Like, you guys don't post any videos.
That's why the podcast exists.
I know,
right?
but I'm just putting you in there. I'm putting you in
Yeah.
there because you guys are very intelligent people. Y'all don't do this. Like, you need to make a video like that and say, it's good for you. You'll be fine. And then pull that book out and be like, go and see this book right here, Pregnancy and Research. You know what I mean? Because what?
But look, here's the problem. These guys have all day.
I know, bro.
You
That's
know
what
what
I'm
I'm
saying.
saying?
You're
Like
busy.
my job
Yes.
is like I see 20
Yeah.
patients and I got documents to do and
I
I
know.
got like all
I
this
know.
stuff to
But
take care
hey,
of, and
dude.
then it's like
Dude, watch. Let me show you something real quick. Okay, 5 seconds. Acetaminophen is bad. Is
yeah.
good. Is
Yeah,
bad.
yeah,
Or
yeah, yeah.
is good.
Hey,
Okay. See. You
look,
see what I'm saying?
I want to
You're right.
point out
You're right.
another thing because I
You're
think
right.
it's important
Point it out.
to show real quick
Show it.
is this happened in the last week or two too. So nurses with doctorates cannot tell patients their doctor, courts rule.
What does that
This
mean?
happened in California in a California state court, and I think I just wanted to show this headline and show this September 29th, right? So this is recent.
What does that mean?
So it has to do with nurses that have PhDs trying to be like, I'm doctor, you know.
Oh.
Yeah. And look,
Uh,
no, I want to thread this needle because again, I think this is the problem is I actually want to identify with both sides because I'm not just going to fall on the side of doctors. And you know that I usually am like, I hate this. I hate this shit. I hate this so much. And I'm so happy that that court decided that way. But it's not that I don't want, like nurses that are upset about this are going to be like, well, they earned their doctorate and
Yeah,
that's
bro.
so
Earned
unfair.
it.
They did. They did.
Gender
And they
equality.
deserve the recognition in the title, just like a doctorate at a university should get for being. I called every one of my professors in undergrad, in med school that were PhDs,
At the
doctor.
school.
They
Yeah.
deserve that respect. They do. They deserve the respect of doctor. They have gotten their doctorate in that discipline. You are purposely obfuscating and confusing a patient by using the title of doctor in clinical practice.
Mm.
And if you do anything other than than represent yourself accurately, you are just come on. Like
You're an idiot.
stop pretending that you're
Idiot.
not
I'll say.
doing what you're doing. Right.
Idiot.
Stop playing the game of, oh, well,
Doctor.
yeah. Like if you're not an MD, if you're not a DO, and you're not doing medicine in a hospital, you're not a doctor.
Get the hell out.
Dentists at
Dude,
at their practice
bro.
can't call themselves doctor. I don't care about that one. You know what? A chiropractor
is a
at their
doctor.
chiropractic practice can call themselves a doctor of chiropractic medicine. I've just lost the ability to draw
DC.
too many lines. But
I don't know,
stop
dude.
trying to stop.
What
trying to
about
confuse
doctors
people.
of physical therapy?
Stop. The physical therapists have do a very serious role, and again, that's what I'm saying is, you
Good
know what,
answer.
you're trying to just f
Good
with me right
answer.
now.
I like that.
No, I
like
love
that
physical
answer.
therapy. Physical therapists are
What
conventional
about doctors of
medicine's
occupational
answer to
therapy?
what?
Isn't there doctors of occupational therapy?
Yes,
Okay,
that's a great thing too.
good. But
And I would recommend them over chiropractors pretty much every day of the week. I know there are good chiropractors out there, but look, their discipline is not
they're
regulated
not
the same way
doctors
physical and occupational therapists are.
outside of
Yikes.
their practices.
Look, let me.
Is that correct? Is that what we're saying?
Hey,
Out of their practices.
For 5 seconds.
Okay.
2 minutes. I gotta go check on Sam real quick.
All right, I got you.
Do you have something that you can talk about for me? Because I have like 2 more topics that I can go on for the rest of our show. But
me.
Okay.
I'm about to hit this up like Johnny Manziel on a Friday night.
Okay, I'll be right back,
Johnny
guys.
Football. All right, we're gonna let Stuart attend to his child. He's being a great dad because Katie's not with us tonight, so he's not asleep yet. Because Katie usually puts him to bed, I guess, because his father doesn't do that. I'm totally kidding. He does. All right, so I want to jump in right here. Let's talk about, since we're talking about Tylenol, we're talking about women's health. Let's talk about lifting weights, ladies. Let's talk about that. Okay. So if you're a pregnant woman, we'll start with pregnancy. If you're a pregnant lady and you haven't been working out, you don't need to start working out right now. If Dr. Martin tells you otherwise, that's up to him. But I'm just telling you right now, if you're a woman and you have been exercising during your pregnancy and before it, then I'm talking to you. But other than that, consult with your doctor first. So, one of the biggest myths in fitness is that if women lift weights, they'll get bulky. Let's put that to rest really quick. Let's do this really quick. So, I had a client come and see me. She's 42 years old, and she was concerned about, she said, you know what? I don't want to get bulky. I want to lift weights, but I want to get bulky. And I told her it's impossible for you to get bulky. When you think of bulky, what happens is you're thinking more about like getting bigger. As long as you keep your nutrition in check, because the only way to cut down on your body fat is to make sure your nutrition is in check. This is what I told her. And you eat less and you move more, you won't get bulky. I promise you. So let's cover this really quickly. Why the bulking myth is false, how lifting actually changes women's bodies, and let's talk about the mental and physical confidence strength training builds. So I guess the bulky myth, where it came from, it's old school fitness culture. So women were told to stick with light weights, cardio, toning classes. I remember as a kid in the early 90s, my mom was into fitness. She still is, but she was really into fitness. And that was like when Jane Fonda was wearing, the leotard. My mom wore the leotard. She tore up the leotard. And I was like, Mom, why are you wearing that leotard? But anyways, they had her in the classes. That's all she did was teach classes. She touched aerobic classes. She didn't hit the weight room. So that's where that old fitness culture thing came in. They even had like women's only little areas. You couldn't come out of that little women's place. You had to stay in that women's area. You couldn't come out of that. Did you know that, Dr. Martin? They could, but
Yeah, no, women's fitness. Yeah, you keep going, man.
they had
But
like a
yes, I
little
was aware of
room
that.
where it was
Yeah.
like women's only, no men in here.
Yeah.
So the fear of muscle too. So media showed female bodybuilders. They were big people, so scared women. I wish Katie was here today so we could talk about this. But the truth is,
She has this fear, dude.
I know she does.
Yeah.
And I hope she's listening. So those physiques require years of specific training, nutrition, and oftentimes some enhancements. So steroids, some of them. Yeah. You get that?
Yeah.
You get that? So again, the reality check is most women struggle to gain large amounts of muscle due to what, Stuart? You weren't listening to me. Due to a lower testosterone. He wasn't listening.
I was.
No, you were too busy looking at your TikTok. So what lifting actually does for women, let's talk about this really quickie.
Okay.
So it improves body composition. So lifting burns fat, builds lean muscle, creates a toned look most women want. So Katie, I know you're listening to this later on. If you want to be toned and continue to be toned after you have that beautiful baby of yours, you need to hit the weights and then go for your walks.
For your perimenopausal years too, right?
True,
like,
bro.
Let's talk like,
dude,
man,
true.
I would say the women that come to me in their early 40s, mid 40s saying it's all because they're hormones now that they're putting on weight. And I'm like, yes, it is. But that's a difficult conversation to have with ladies because look, because I
sensitive, sensitive.
Literally, yeah, I mean, they literally said like my PCP saying it's age related versus perimenopause. And I'm like, so that I see both sides. I mean, even said like I see both sides of that argument. Like it is perimenopause, yes, but it is an aging process, and women age worse than men. They do through their 40s to 50s. They like,
it sucks
guys,
for them.
they do. It does. Yeah. So you have to be more prepared than the average guy.
Yeah. And that's what and you weren't in here earlier, but what I was talking about was if a pregnant woman was going to come and see if they were going to start exercising, they make sure to check with you first. But I told them, I said, if you've been exercising, this is for you. If you've been before your pregnancy, during your pregnancy, and Dr. Martin said it's good to go, but if they haven't checked with you first, they better not listen to me. And then I also said, if somebody is wanting to put on muscle, you better be listening to me. And if you're a lady that wants to do this, you're listening right here. So,
I mean, like, look, not while you're pregnant.
No,
right?
no,
like,
I said, I said, while you're pregnant, I said, don't listen to me. Like if he hadn't said nothing, but I said, okay, but we're talking about bulking up and all these things. So I'm just trying to give them just a little bit of a little bit. So boost metabolism. So more muscle equals more you're gonna burn more calories at rest. You're gonna
Mm-hmm.
increase your strength and independence, like carrying your groceries, moving furniture, play with your kids with ease. But if you're pregnant, don't be moving the furniture. Don't be
Yeah.
doing those things. Stay
Yeah.
away from it. But if you're not and you're perimenopause, how come it's called peri and not premenopause?
Well,
Who
because
made it up? Was it
so
Perry? Orlando Perry?
technically, when you're 1 year old, you're
Uh-huh.
premenopausal.
Oh, shoot, never mind.
Well,
There you
well, I
go.
wouldn't say. Yeah, I don't know. I don't know if that actually fits it. I mean, technically, again, every woman that's ever been born before they start menopause is premenopausal, right? And I remember that was the argument
That's
made to me
cool.
about saying pre versus peri.
Mhm.
But I would say at least it means anybody who's postmenarchal, which means after your first
See, I
period,
didn't know that, dude.
right?
Thank
So like
you.
a 15-year-old is pre-menopause. I mean, they're before their menopause.
Wow.
So peri,
Oh,
the Latin
Perry.
root means around,
Mhm.
right? So
Oh.
around the time of menopause, and that can be as early. Let's be clear about it. I keep messing with my mic. That can be as early as 10 years before the average age of onset of menopause, which
Ooh.
in the United States is around the age of 52. So again, plus minus 1 or 2 years, I always tell patients this too. It will include about 99% of women. So when you go from like 50 to 50, actually, I think it's not quite 99, but if you go from like 50 to 54, you're going to encompass, I want to say, and now that I'm thinking about it and I'm trying to remember the studies, actually, it's like 95%. So you're including like 95% of women would naturally go through menopause somewhere between the age of 50 and 54. Some will be before, like, I mean, there are women that in that 5% that fall like at 45, 46.
Yep.
Uh, anything before age 40 is something, well, actually, it's a few years even before that, I think. We diagnose as premature ovarian failure, which is a totally different thing, totally different bag. We're not going to get
Oh.
into that today.
Yeah, don't get into that.
No, but again, menopause. So perimenopause is the 10 years even leading up to that age 52. So 42, you can be perimenopausal and potentially need HRT, potentially be needing to kind of think about how you work out and get your muscle mass out before you're into your menopausal years, which are even tougher to
Well,
do
yeah,
much
so what
with.
you're basically saying is you get older, it gets harder. So
Yep.
you need to be
You build your
starting
reserve.
now. It doesn't
Yep.
matter. Start today. So build confidence, mental toughness, health benefits, better bone density, improve posture, lower risk of injury, longevity. So what you can do, ladies, to start lifting without fear. I love kettlebells. I love dumbbells. I love your body weight. Squats, kettlebell swings, deadlift, presses,
I
rows.
love your body
I
weight.
love your body. Consistency. I do love your body,
I
ladies.
love your body
Love
weight.
it all the
I
time.
love that body
Love
weight.
that body weight. How much you out? I always, anytime I'm doing anything with just my body weight, I'm always like, man, this weight is heavy over here.
That's a
Cons-
big heavy weight
All
right
right, I'm
there.
almost done. I'm almost done. Consistency over heavy weights. It's about showing up, not maxing out. Form first, then load. Quality reps. 2 to 3 workouts a week is enough. Okay, so it doesn't take a long time. So if you have a home gym, start there. If you don't want to go to the gym, that's okay. Get you a kettlebell, get you a set of dumbbells, and you can go online. You can buy my ebooks. They're everywhere. Go to my website,
You got some
bustostraining.com.
ebooks?
Oh, yeah, dude. You don't know
Okay,
that?
hit up the ebooks again. What was that? You just I
So
interrupted your
if you no,
actual.
no, no, if you go to my website, BUSTOS training, so bustostraining.com, it'll take you to everything, anything that you want to know about Bustos training. So it's all there. It's everywhere. It's there. But yeah, so again,
This
recap.
guy's good, guys. I'm
Thanks,
gonna try to
guys.
actually clip this so that we have this out there, so you guys
Oh,
know. Hit
yeah.
this guy up for your
Thank you.
training and
Thank you.
fitness
That was a big time
recommendations.
plug and
Plug.
yes, thank you, Dr. Martin. Lifting
Yeah.
won't make you bulky, it'll make you strong, confident, toned, and powerful. But again, if you're pregnant and you've never worked out, go talk to Dr. Martin. If you're perimenopausal, if you're premenopausal, if you're menopausal, go talk to Dr. Martin before you do anything. I always want you to I always that's always my response. Anytime I get anybody like online, they send me something or they're like, hey, I got this left knee that doesn't move well. I got this neck pain. And I just had I had a
Hit up
lady
your
the other day
doctor, dude.
say, I
Yeah.
love the lady said, hey, I had a hysterectomy. No kidding. Just had a hysterectomy about 8
Yep.
weeks ago. And she was like,
Yeah.
what should I do? I said, well, first off, go talk to your doctor, your OB-GYN, and then see
Yeah.
if you're able to do anything because I'm not going to tell you. But other than that, have a good time.
Yeah.
But there you go.
Okay. So look, I have one more medical thing this week, and then we're just gonna hit up. So this is gonna be a TikTok thing, but I also I just have so many good TikToks for us to like go through this week and like talk about real quick. But first, I want to do one more TikTok that has relevance to the medical world, and I just want to again. I hope that like people understand why I do the TikTok stuff and why I criticize some of the alternative medicine community is to be an advocate for patients as an alternative in the conventional space, if that makes any sense. Because I am not here to judge you for wanting some of the things that are desired out of that community, which is a safer space, which is a difference in people. Like, okay, so the thing I'm about to show you is something about home birth. And the reason people are such big fans of home birth is because
Yeah,
this
why?
idea that it's safe and like they feel safe and
That's
that
my
they're at
brother, dude,
home
calling
and
him
that
out.
bad things don't happen to them there.
Oh, they do happen there.
And they do. They absolutely
They do
do.
happen there. I can speak
And
from
then when those
experience of
bad
a
outcomes
family member.
happen, they tend to ascribe it still to the healthcare institutions and infrastructure that they were so hesitant to incorporate into their healthcare.
Yeah.
And I understand why. I understand that a lot of like my constant daily thing is trying to tell patients that like my job is to advocate for the best interests of your health, but I do not believe in a paternalistic model of healthcare. Like my job is to like advocate for you and
Right.
sometimes disagree with what you may think is best for you, but I am not here to tell you how to do this without your input.
Yeah.
But again, I just want to show this video because I felt like this spoke volumes. And the guy, the doctor who puts it out, it's a much more popular doctor on TikTok named Dr. Vitreous. And I gotta believe he's like an ophthalmologist or something because vitreous has to do with the friggin' eye. So I'm just gonna believe that well, yeah, I don't maybe yeah, I'm not even sure. I'm not even sure what the vitreous actually has to do with. Maybe that's his last name too. Anyways, regardless, this guy is not an OB, but he does a lot of videos. And I just thought this was a very particularly good video to share to kind of highlight something he's pointing out, but I can even speak better to. So here it is. For those who have told the lie that birth has to be scary, dramatic, and traumatic. So here's this woman sitting at home in some makeshift tub with her husband with a as classic a
Looks
garden
looks
hose as
comfortable,
could
dude.
be.
Looks comfortable to me.
Yeah, but here she is doing her comfortable home birth.
I'm sure the kids will swim in it afterwards.
Birth at home, and so that it doesn't have to be scary, dramatic, or traumatic.
Is the baby out?
And boom.
Oh, dude, that's
So,
crazy.
do you see it? Do you see it as a non-clinician? You see what baby that looks like right now, right?
I
That
can't
looks
really
like a
see.
zombie baby. That looks like a corpse baby.
Yeah, dude.
Listen
is it
to
dad,
what
dude?
this like.
Is it dad?
Oh my! Anyone knows that that baby is hella blue and should be in the
Hella blue is what this other doctor calls it. Yes, that
Oh,
baby
dude, the
is
baby's dead, huh?
hypoxic AF is the other way I would put this.
Wow, how
And
sad.
so who knows what the outcome of this was? I guess everything ended up okay.
So if you see a
But
blue
like
baby like that, you're like, code blue, or code. We
that
gotta.
baby is getting hard resuscitated at the warmer. And here's the thing.
Do
Here
you
is
do?
the
Do you do
craziest
that?
thing about this. You know what? This page, I guess everything ended up okay, right? Because I don't know why you'd post it
Yeah.
otherwise.
Okay, but
if I'm sitting here going, that baby needed to be resuscitated, all this stuff needed to happen to it, that's the argument they would make against
wow,
what
dude.
I'm saying
Yeah,
right
because
now.
you're trying to save its life.
Right. Exactly.
you've
And
had
this baby somehow probably miraculously ended up okay.
yeah.
And then you're going to point to that and share that on the internet and push the narrative that everybody should do this. And then you're not pointing out the glaring thing that people who are not going to be attentive enough or know well enough to know that that looks like 9 out of 10 of those babies are having hypoxic brain injury, if not altogether not making it out of this. Like
She probably
that
took
to me
Tylenol.
again is like,
Just kidding.
take some Tylenol.
Take some
You know,
Tylenol.
I mean, it's just,
It's stupidity to me, honestly.
I
I'll say it.
know
You can't say it.
well,
But
it's irresponsible. It's irresponsible, and it really does sadden me on
yeah,
such a
man.
deep level of like, I wish I like because there's just so many people in the alternative birthing world that somehow enter into my sphere a lot of times. They're like, I just wish I'd known there was like somebody like you know what I mean? Like just somebody that didn't scare me this way. And that's where I'm like, because I know ultimately everybody's they just want the best outcome for their baby. And
Yeah.
like that's my job too. And like that's what I try to explain is like, look, we're just trying for the same thing here. I'm happy to let you do it however you want as long
Yeah.
as it's safe. And they just feel like the traditional healthcare model is meant to like hurt them somehow. And I can see how they think that. There are things out there to show them that that could be true, but it's not.
I don't get that type of mentality because
It
I don't
look,
understand it. Because
I
me and my brother grew up in the same house,
yeah,
and my brother's had 3. His wife's had 3 home births,
yeah.
and every single time I'm like, even me, I've never had a baby, but I've been
Mhm.
around. My wife has had a baby, and it looks pretty. She's amazing, but it looks very intense. Okay,
Yeah.
so yeah, I don't know, dude. You're at the house and there's no doctor
Well,
there. I know they have
and
what, a midwife or somebody or a
right,
doula or
and,
a
like, here's
medulla
the thing
oblongata.
again
I
is,
don't know.
yeah, here you go, medulla oblongata. Yeah, I mean, it might as well be a medulla oblongata because, again, that sphere is so infiltrated by I can't say it other than like a lack for another word of a poser, and people don't know how to discriminate those things, and
It's sad.
law, like, medicine has for a long time been very good at self-regulating, and the law has been very pretty good at self-enforcing. But what's weird is like, um, you know, people that are held to the highest standard, doctors, certified nurse midwives, like they're the ones that usually have the biggest repercussions to not doing the right things and performing up to the letter of the law for their patients.
Mm-hmm.
But when you talk about midwives, that's a word. You just said midwives. You didn't say a certified nurse midwife, right? And
Ooh.
that's where you get into, again, you get into this doctor quote
Oh
unquote world
shoot. Dentist delivering
because there
babies.
are certified professional midwives. And do you know how much nursing experience those certified
A bunch.
professional
They got a
midwives have?
bunch.
0.
Oh, they have
They
0
are
of it.
like, the way that stuff works is completely unregulated. These
Oh,
people are
0.
not, they're licensed by some licensing body that, might as well exist in freaking Timbuktu because it's not, you are literally employing a lay person
I could do it.
to take care of your pregnancy.
I'm gonna do it. Yeah.
Well, and
I'm
again,
gonna do it.
that's what I'm saying. It's like when people want to quote things about home birth versus hospital births, they don't understand too that a lot of data that talks about safety of home births has to do with European data,
Yeah.
where that model actually is more centered around at-home births versus hospital births. Like they actually have a very different medical system in terms of infrastructure and how that works and identification of at-risk births versus here. You delivering at your bedroom at 1 a.m. with a certified professional midwife who's not really licensed or regulated by any medical authority and coming in after 3 days of labor with almost absent variability fetal heart tracing, that's a bad outcome.
Yes, it is.
And I know you don't know everything I just said, and neither does everybody in the podcast like have to listen to understand that. But like the problem is that there is no enforcement in terms of like you knowing that that's right or wrong for you.
Yeah,
And that's where
yeah.
like, again, doctors are important and they're not your enemy. I think the more and more of the younger and modern physicians that come out, the better they are at trying to, I hope they're trying to understand their patient's perspective like I do still. To see that there is fear with the modern medical infrastructure in America, but that, like, again, if you try to put yourself in your patient's shoes, that you should see why they do the things that they do and try to redirect a little bit.
Yeah.
You're not trying to confront. You're trying to redirect. You're trying to redirect emotions into productive, constructive ways of taking care of them.
Love it.
And make them understand that. Don't fight them. Try to educate them on
That's right.
true understanding of the issue.
Listen
Okay.
up, doctors.
Listen up, doctors. All right.
Doctor of chiropractor.
No, we're not
Oh,
talking
sorry,
to them.
not those ones.
Yeah. Okay, so where do we since we've been a little bit serious already. Okay. I'm gonna first do one more serious thing today, and I think that's always like our message or like our philosophical take for the week. And I'm gonna take this before we just go straight funny viral TikTok stuff. I can't wait to show you some of these things. I'm just like so excited. But let's go college football as our source for inspiration for the week, man.
Oh, wow.
And you want to who would you say out of modern football coaches in the college football arena, modern meaning they don't have to be current active coaches, is the most Socratic. Sorry, I can't even believe I just made up that word. Socratic in terms of like just insightful about how you should approach life.
He's probably an SEC coach.
He is an SEC coach.
It's either Saban or it's
Yeah,
probably Nick
don't even
Saban.
guess it. Nick Saban, bro.
Because
So
I was gonna say Dabo, but Dabo don't really say much.
Dabo's not that insightful. Dabo's kind of like what's his name from Michigan, who's now in the NFL.
Jim Harbaugh.
Yeah,
like
Harbaugh. It's like their recommendations are like, tell your kids to drink whole milk, which I kind of buy into, but like their philosophies aren't real. Like, I honestly think Saban has some kind of pulse on the human athlete's psyche. It's like very weird. Like that's why he was so successful. He knew how to breed a winning culture.
Yeah, could you imagine him with women? Holy cow. Listen here, man.
I'm not even going to get into that. But what I want to talk about is an old Saban quote where he talks about mediocrity and high achievers. And this was early in his years. Like I think within the first few championships, he had a press conference where people were talking to him and he said, mediocre people, and this is my like, let's, because I tell people at least once a week, we're going to talk about something mental health wise and like how you should approach life and look at life. And I saw this quote a while back and I was just like, man, Saban, this is Saban-esque and this is so like our vibe. And again, he talks about how mediocre people and mediocrity does not tolerate high achievers and high achievers do not tolerate mediocrity.
Yeah.
And how if you want to breed a culture, he would talk about getting on the bus for his preseason. I forget what they call it, kind of like summer training camps, like training camp. he would try to be identifying those on the bus who belonged on the bus and needed to be on the bus to be in that high achieving culture, and those who didn't need to be on the bus, who needed to get off the bus because they were mediocre and they were happy with mediocrity and they didn't like high achieve. Like they were basically, I'm not going to use his other term, his other most famous inspirational quote talking about rat poison, but I'm going to say, like, again, the two cultures and the two types of people do not jive. And he said, at some point in your life, you're going to be faced with that. You're going to join a place. You're going to be in a culture. You're going to be somewhere where they're going to try to be determining whether you are that person they need to get off the bus or you belong on the bus. And I'm going to take that a step further and say, like, forget you being the person being determined. Like, let's talk about you being the boss bitch, right? Like, why are you not determining your own culture? Why are you not deciding, are you not going to dictate that you're going to have a high achieving culture around you, that you're not going to tolerate mediocrity? You don't have to be the one judged. But I do think that is the core of the quote, right? Is that you ultimately have to decide whether you're comfortable being who you are, being okay with where you are, and surrounding yourself with people like that. Or you need to find people that are movers and shakers, or you need to be a mover and shaker and decide who gets to be around you because they are of like mind. And that's like you and me in this podcast, right? It's kind of like, we eventually decided, like, you and me want to do something with this. Like, and that's what I think everybody has to determine with themselves. It's okay, I guess, to be mediocre. No one has to be that way. You don't have to be that way. But you should actually realize that you have determined that that's okay for you when you're unhappy with what's going on, and it's self-deterministic. So he also pointed out one thing that I think this is truly the core of our mentality, Andrew. Is he said, when I worked for Bill Belichick, he said there was one sign up in the building. Do you know what that sign said?
I don't. No.
Do your job.
Oh, that's a big one.
It defines it all, right? Like,
Yep.
I think if we, it's just, it's a little too
Easy.
authoritarian almost, yeah, and simplistic, I think, for today's generation in some ways. But
No,
it is
dude.
so reductive and so easy, and it solves so many problems in life if you just think that way.
Yeah.
And that's, I think we say, like, winners find a way, losers find complaints. Like that kind of idea is like, or find excuses. Sorry, not complaints, excuses. And that, do your job.
Just do your job.
Just do your job. Just go to the gym. Just go 3 to 4 times a week. If you're angry that you have to go, who cares? Just go.
Just go.
Just go.
Just go, bro.
Just go and see what happens.
Just
Even if you think you're like, I'm not going to do anything there, just drive yourself there, walk in the doors, and see what happens.
See the magic happen.
Because you will do it ultimately, right? Like that's what's going to happen.
Yep.
Again, the do your job, but then like, okay. So, all right, now we're on to the fun stuff. I already told you, I'm not going to get too into this week, but I talked mad,
Ain't gonna matter no more.
Me and this Barstool sports guy have been going at it back and forth over like Miss State versus A&M because my Aggies won again this week. Hell yeah.
I just don't understand what the argument is. Like, why would
dude,
he
was saying,
Mississippi State?
He was saying the programs are basically the same because since A&M has entered the SEC, they're 7-6 as a record. And I was like, that is not how you qualify a program as
head to head. head to
Yeah,
head.
head to
Oh,
head.
yeah,
You
that's
know,
not
I
how you
mean, this was
qualify it.
in the era of Dak Prescott when he was still
Yeah.
in Mid-State too.
And Dak was
Like, it's
good
just
in college too.
and A&M had a bad era
Yeah,
after
that was
Johnny
the
Manziel. Like
that
we
was
we went through a
the
couple years of like 6-6 kind of stuff.
who was the
Like
black coach?
Kevin
Kevin
Sumlin.
Sumlin.
Yeah, he didn't have a few good years after Johnny Manziel.
Yeah.
I mean, we went through a little bit of a wilderness. And so like, Kirby, like, Miss State and y'all have the same record, so you the same program, even though y'all spend all this money. I was like, oh, I can't wait for this game now. And I mean, the spread was like 14. He was like, I think you're gonna upset them. Like it's the same program. So I couldn't wait. I massively like, what was this guy's name? Dude, I just want to show this guy on here because like I'm gonna
You're gonna
share
call him
this
out.
video that I shared to you of him talking after people like me just ate him up online recently.
Yeah, I don't understand why anybody would argue against A&M this year. A&M is loaded.
I mean,
They're loaded and they're
they
talented.
still, saying they're overrated is stupid. It's
No,
that
they're not
they're
overrated.
inconsistent. They're
They
inconsistent.
can win
They
the
are.
SEC.
All of the people in here that came in here to watch me suffer tonight. I want to thank every single person that walked in here and opened the door and sat their fat asses down on the
Apparently, I'm a
misery couch and
fat
said,
ass.
I want to watch him suffer. I want to watch him bleed. I want to watch him
This
die.
is the guy?
You thought
Yes.
you were going to see that.
Oh,
and
I
guess what?
talk
You were right.
him
For the entire first 6 years of my tenure, that's exactly what would have happened, but not anymore. Not anymore. You watched joy here tonight. You watched love here tonight.
He gets like crazy
You watched
delusional.
a miracle here tonight. You watched beauty here tonight. You watched. I have no idea where I am right now.
No,
So, like,
but what's funny is most people, like, if they're arguing with you, and I'm sure you brought the heat at him.
oh,
he's
dude,
never
so him and the official account, Mississippi State Productions, started coming at me being like, because I was like, I don't even understand your point. Like, I don't, because there's other videos where he's talking about like, oh, y'all spend the money and we're like 7-6 again. I'm like, what's your point? Like,
Yeah, they
why
can't.
are you arguing what your record is against us versus how we're the same program? And they're like, Miss State Productions come there and says like, blah blah blah. Sorry that we're basically the same record. Thanks, buddy. And he said thanks. The Miss State Production said thanks, buddy, to me, and I was like,
Wow.
so
They
look,
obviously don't know who they're texting or commenting with.
so they deleted half of my comments again because I know I flamed them and owned
wish
them.
I could do
and
that.
it was and it was stuff where I was basically like, look, at the end of the day, what this all seems like is that you're latching on. Like,
Yep.
you guys are finding identity with your program by saying that you're close in record to a program that's clearly on the rise
Yep.
and definitely relevant this year. Like, just stop. Miss State was unexpectedly good. They are unexpectedly good. They really are. But like trying to be like, oh, we're basically the same level as A&M. Like, that just seems like desperate, like, kind of like, again, latch value. Like, you're trying to find a way to make your value relevant through another program's relevance. Like,
Yeah,
I hate that.
yeah.
Yeah, because I mean, like, look,
This feeds into your delusion of Texas A&M.
look, like, I can I find the way to find the comments here? Like, I mean, again, I was definitely in here. I almost don't want to show my own personal.
Yeah, you're pretty brutal, I bet, on there.
Same program, 14 points crazy. This is aging well as predicted. Trash inside.
Oh, dude. Dude.
Like, and then like they deleted some of my other comments because again, I had to come hard. Okay. Next, moving on to the next funny thing I've seen. Have you seen these new, like, there's just this huge relevance of, like, I forget what they're called, Sauna or Cinna
Nope.
edit videos, and they've just gone
Nope.
crazy with Stephen Hawking doing all kinds of crazy things. And you know who Stephen Hawking is, right? The
Yes.
most relevant, brilliant astrophysicist of our modern generation. Okay. Well, here he is entering a half
Here
pipe.
comes Hawking, building velocity down the drop, straight into the transition. He's off the full
Bruh.
inversion. Look at the altitude.
Hold
You
on.
guys are
Here's
wrong.
another.
You guys
Here
are
you
wrong.
go. He's at NASCAR.
There's a man on the racetrack. That is Stephen Hawking. He's in a powered chair and he is flat out racing the field.
I gotta go.
Bruh,
I gotta
bruh.
go.
No. More.
Please,
Battle
no more.
bots. Battle bots.
I gotta get out of here.
Taking the hit on that reinforced wedge, holding his ground. Keep Einstein talking through the drop.
Here we go.
Sorry,
Entering the
guys.
half pipe again. Hold on. Here we go.
He's
Dropping in, baby. Woo! He landed it. Landed it. There he is.
Okay, I
Stephen
can't
Hawking.
anymore.
Here he is. Your favorite wrestling dude.
Hawking up to the top rope. It shouldn't even be legal. Stephen Hawking is airborne.
Oh, my
Cross
word.
body for the professor.
He wiped out both men.
The crowd is
Okay.
losing their
I can't anymore. Please don't.
Okay. So that I can leave it there a little
Yes,
bit.
I'd leave it there.
I will leave
Until
it
next
there.
time.
I will leave it there until next time. Look, can we just, what have you been watching lately? Can we do that quick thing too? I want to do that because there's just been so much good TV lately. What have you been watching, dude?
Nothing, dude. I just told you about the Marvel zombies. That was about it.
Yeah. Why, bro?
I haven't
Why
watched
just
it. I don't
watching
watch
that?
anything. I watch
Okay.
football, bro. It's football season.
Football, bro.
Football. Give me the ball.
You've been watching Notre Dame just pass the mustard. Yeah. Okay. So I'm going to recommend a few shows for the non-existent female listeners who like Marvel and comics. I think Peacemaker season 2 is very strong again. James Gunn is an incredible writer and director. DC Universe is lucky and blessed to have him. It's amazing.
Blessed,
So
eh?
if you want to check out Peacemaker, check out Peacemaker. The other two things I'm going to plug hard.
Plug it.
My God, Love is Blind is back out. It is amazing. Me and my wife, Katie, love it. We'll break that down soon enough. Don't worry. Love is Blind's amazing. This is the best season in a while. So if you're a fan of dating dramas and stupid trash TV, Love is Blind's amazing. Final thing I'm going to plug, bro. Are you not watching Monster, the Ed Gein story?
No, dude.
Oh, dude. It's good. It's good. Like, it is as good as the Jeffrey Dahmer one, if not better. Obviously, put your kids to bed. Do not watch this with your kids around, but it is amazing, and I would highly, highly recommend again. All right. Well, I guess that's all I got. I mean, you're
That's
just like
great.
kind of cutting me short. I have some cool other stuff to show us,
Next time,
but I
dude.
guess I'll save
Next
it for
time.
next time. Next time on
He gets
Muscles
excited.
and Malpractice. We actually, this was a very medically relevant episode. I kind of feel proud of us today. What do you
Yeah,
think?
dude.
What do you
I
think?
liked it. It was good.
Yeah. You got
you
the
know?
backwards cap rolling with your long hair. Like,
Make sure
can you
take
sing us
your
like
acetaminophen.
baby, bruh? You know what song that is?
Isn't that Justin
Who
Bieber?
sings that? Yeah.
baby. That was good.
There you
Bieber
go,
right
dude.
there.
There you go. The J Beebs is signing off tonight. You got anything for our listeners before they go?
No. Take your acetaminophen when you want to. And
Good job.
that's about it.
Okay. Well, for the Muscle Malpractice family, from ours to yours, with a missing Katie Martin absent tonight, but soon to be back next week. We definitely encourage y'all to follow us on TikTok, Facebook, Instagram, X, like Katie just learned we have a page for. Please follow us. Please comment. Please reply. Please let us know what we're doing right, what we're doing wrong. We love to hear from you guys. We love the follows. We love the likes. It helps keep this alive, man. There is some cool developments professionally for me. I did not disclose tonight, but I just can't wait to tell you guys about for the future that I'm doing some advisory roles in the industry.
Yeah.
I'll save that for another episode. I
When
have
your
some
wife's
other
on here, so she'll be
Abilene
like,
type
"Oh my
roles.
gosh, Hercules,
Right.
Hercules.
But just get excited for that, and I'll have I'm gonna even do some live stuff from locations soon in the next 6 months or so. So
Whoa.
we're gonna do some cool stuff. coming in the future. So just please keep following us
This
and
is
listening
Dr. Martin
along.
over here for 105.3 The Fan. Oh.
Or just
Oh.
Muscles and Malpractice. Just keep following us here because that's what we love to do.
You said you're going to be on location. I don't know if you were doing like a radio show.
Location in Las Vegas at SMFM in February, dude.
Oh.
But I can't tell you who's paying for that trip yet or anything else. But that's what's happening, bro. Like
Love
it's a big deal. Like we're kind of blowing up a little bit.
You are. I'm just the guy that hangs out over here.
Oh, please. We love you, J-Beebs. I love you so much. Anyways, y'all have a good week. We will be back normal date, normal time next week. Hopefully this episode comes out in the next few days. We love you guys very much. Thank you for your follows. Have a good week. Talk to you next time. Bye, guys.